Creatine, long associated with muscle strength and athletic performance, is now being closely examined for its potential role in mental health, particularly as a supportive aid in mood disorders like depression and anxiety. While not a replacement for traditional treatment, emerging research suggests that creatine may influence key biochemical pathways related to mood regulation, offering a safe, low-cost supplement that could enhance resilience and emotional stability in people facing mental health challenges. At the center of this interest is creatine's role in brain energy metabolism. The brain consumes vast amounts of energy to maintain proper function, particularly in areas responsible for emotion, attention, and stress regulation. Depression, anxiety, and other mood disorders are increasingly being understood not just as chemical imbalances, but as conditions that involve energy deficits in brain cells, especially in the prefrontal cortex, hippocampus, and basal ganglia. Neurons in these regions rely heavily on ADP, adenosine triphosphate, to function properly, and creatine plays a key role in rapidly regenerating ADP through its phosphocreatine system. When this process is sluggish, as it may be in chronic depression, neural signaling becomes less efficient, cognitive fatigue increases, and mood regulation deteriorates. Supplementing with creatine boosts the brain's ability to maintain stable ADP levels, particularly under stress. This metabolic support alone may help improve focus, mental stamina, and emotional control, especially in people who feel mentally exhausted, foggy, or emotionally numb. But there's more to the story. Creatine may also influence neurotransmitters, particularly serotonin. Several small studies suggest that creatine can enhance the effectiveness of selective serotonin reuptake inhibitors, SSRIs, the most commonly prescribed class of antidepressants. In one clinical trial involving women with major depressive disorder, participants who took creatine alongside their prescribed SSRI showed faster and greater improvements in mood than those taking the SSRI alone. Researchers believe this may be due to creatine's support of the energy-intensive process of serotonin synthesis and signaling, especially in individuals with impaired brain bioenergetics. This adjunct effect has made creatine an area of growing interest for psychiatrists and researchers looking for safer, more accessible treatments that enhance standard care. It's especially promising in patients who are slow to respond to medication or who experience cognitive dulling or apathy, symptoms that may reflect the energetic deficits in brain regions linked to mood. In anxiety, while research is more limited, there's a theoretical basis for benefit as well. Anxiety involves hyperactivation of stress circuits in the brain, particularly those governed by the amygdala and prefrontal cortex. These regions require large amounts of energy to regulate emotional responses and suppress fear signals. Chronic anxiety can deplete energy stores and lead to poor emotional regulation. By helping these brain regions maintain energy under duress, creatine may support a calmer, more stable emotional baseline, especially in combination with cognitive behavioral therapy or mindfulness-based practices. Of course, this doesn't mean creatine is a cure-all. The research is still early, with relatively small sample sizes, and more long-term data is needed. Its benefits also appear to vary depending on individual factors like age, gender, baseline creatine levels, and the presence of coexisting conditions. And while creatine is generally considered safe, individuals with kidney issues or those on certain medications should consult their doctor before supplementing. It's also important to recognize that creatine is most effective when used as part of a larger wellness strategy. Nutrition, exercise, sleep, and therapy remain central pillars of mood recovery. Creatine's best role is likely as a supportive tool, helping stabilize the biological foundation on which emotional healing can occur. And for those following vegetarian or vegan diets who tend to have lower baseline creatine levels, supplementation may offer even more pronounced mood and cognitive benefits. In terms of dosing, most clinical studies on mood use standard creatine monohydrate at doses between 3 and 5 grams per day. These levels are safe for long-term use in healthy individuals and do not typically produce side effects beyond occasional mild bloating or digestive discomfort. In conclusion, while more research is needed to fully define its role, creatine is showing early promise as a supportive nutrient in the management of mood disorders. By enhancing brain energy metabolism and possibly amplifying serotonin signaling, it may offer real benefits for people struggling with depression, cognitive fatigue, or emotional instability. For those seeking complementary strategies to bolster mental wellness, creatine deserves serious consideration, not as a replacement for therapy or medication, but as an empowering, evidence-informed addition to a broader mental health toolkit.